And then I just wanted to kind of close talking a little bit about COVID-19 and protecting worker health. So, I do work on foodborne viruses in my lab. And, just to start, there's no evidence that this virus that causes COVID-19 is transmitted by food or food packaging. So this particular virus is what we call an envelope virus. And we know based on existing data that it only remains infectious for a few days at most outside of the body. It's also transmitted by a very different mode than all of our foodborne pathogens. So foodborne pathogens are transmitted by what we call the fecal-oral route. So they leave the body through the feces, they enter the body through the mouth. You actually have to ingest these to get sick. So SARS-CoV-2, the virus that causes COVID-19, transmitted by a totally different route. It's by, respiratory droplet exposure. So, those are generated by someone sneezing, coughing, talking in close proximity to you, and those droplets ending up in your own mucous membranes. There's also been suggestions that there's surface transmission. So if someone sneezes or coughs on a surface and those droplets settle, and then you touch that surface and touch your nose or your eyes, you can also contract the virus, although we've seen a little guidance kind of softening around that surface transmission issue. But all of these characteristics make it really unlikely that food would be a vehicle for transmission. And CDC, FDA, USDA, the WHO, they've all come out and said, this is not a food safety concern. But I would say it's definitely a food industry worker concern. We've already seen the issues in packing houses. We've started to see outbreaks now in the produce industry and, areas where farm workers are housed together, they're transported together. So it's really important that, we understand what we can do to help minimize risks for these essential workers. So providing support via training, doing some kind of screening of farm workers to make sure that people that have symptoms, aren't going to be coming to work and exposing others. I know this can be a major challenge, and, there's all kinds of other social issues that, kind of surround this. Providing PPE if physical distancing isn't something that's possible. One other thing I just wanted to touch on a little bit is cleaning and disinfecting high touch points. So, in the field environment, there's probably, not a lot of these that we would typically think about. So certainly if you have a restroom facility, think about those door handles and things like that. But this might be hand tools or other tools that multiple workers are touching throughout the day. And so the recommendations are for those high touch surfaces that you use a disinfectant routinely to make sure that you're minimizing those risks associated with surface transmission. And so the EPA has published this list of disinfectants that have efficacy against SARS-CoV-2. So the viruses I work with in my lab are called non-envelope viruses, and they're really stable in the environment. They're transmitted by the fecal-oral route primarily, but they tend to persist for weeks or months in the environment. In contrast to SARS-CoV-2, which is an envelope virus, only sticks around in the environment for a few days, but because this virus is new, the EPA took a very conservative approach when they were listing chemicals to use against the virus. So basically they said, anything that works against one of these more stable viruses, we're gonna list it as being effective against SARS-CoV-2. I would say almost all of these chemicals are disinfectants, and they're not listed for use on a food contact surface. So, if there was an instance, say if you were concerned about a harvest bin that someone sneezed on and you wanted to disinfect it, you would have to take some additional steps to remove that residual disinfectant, because if someone were to then ingest it, it could be a health hazard on its own. So if you're interested in understanding, what some of these chemistries are, they're all published on the EPA's website as this list N. disinfectants for use against SARS-CoV-2. The general steps for disinfecting a food contact surface are listed here. Basically, the takeaway is if you're using a disinfectant on a food contact surface, you need to rinse away residual disinfectant and then reapply something that is approved for use on a food contact surface. So there are lots of resources available out there related to COVID-19 and ag worker safety. So I'm highlighting the UC Davis Western Center for Ag Health and Safety. They have a lot of these fact sheets and flyers around ag work, health, and safety. Also on our UC Food Safety website, we have now a whole 6 pages dedicated to COVID resources for different stakeholder groups. And then we also have pages dedicated to pre and post harvest safety. So if you have other questions and we can't get to it today, check out the website, and then my email is here on the bottom of the slide as well. And you can feel free to reach out anytime. Happy to help in any way I can.